Do you know if you are COVID-free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID-19 testing locations around the island. Book online at www.gov.pm/coronavirus-get-tested or call the COVID-19 hotline at 444-2498 between 9 a.m. and 9 p.m. Everyone in Bermuda can help us stay COVID safe.
As the family prepare to lay him to rest tomorrow. His passing is a tremendous loss to Bermuda. He was a truly dedicated public officer who gave his all in service of his country, and he will truly be missed. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update on the progress of our vaccination program, the opening of a second vaccination center, and give further updates from the ministry on the latest to do with the coronavirus. I will provide an update on the arrival of the next batch of vaccines and details regarding the new public health emergency order, which is now in place, in addition to other matters of importance. First, we'll hear from the Minister of Health. Minister?
Good afternoon. Today, there were 543 test results received by the Ministry of Health since the last update, and 2 were positive for COVID-19. Both of the new cases are classified as imported. The first case is a resident who arrived on the flight S46227 from the Azores on the 16th of January 2021 and tested positive on their day 8 test. And the second case is a resident who arrived on B62231 from New York on the 24th of January 2021 and tested positive on their arrival test. Additionally, since the last update, 6 cases have recovered. There are currently 30 active cases in Bermuda, of which 25 are under public health monitoring and 5 are in hospital, with none in critical care. Since March 2020, Bermuda has recorded 688 total confirmed cases of COVID-19. Out of those, 646 persons have recovered and 12 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 43 years, with the median age being 40, and the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 49 years, with the median age being 47, and the ages range from less than 30 years, with the age group being 20 to 29 years, to greater than 80 years, with that age group being 80 to 100 years. The mean age of all currently hospitalized cases is 77, and the median age is 78. And the age ranges from less than 60 years, and that age group is from 50 to 59 years, to greater than 80 years, and that age group is 80 to 100 years. The source of all of our cases is as follows. 198 are imported, 481 are classified as local transmission, of which 397 are local transmission with a known contact or source, and 84 are local transmission with an unknown contact or source, and 9 are under investigation. As investigations proceed, transmission categories may change. Today's update has 1 case moving from under investigation to local transmission with a known contact or source. Of the over 160,000 test results reported, the mean age of all persons tested is 43 years, with the median being 42, and the age ranged from less than 1 to greater than 100 years. The 7-day average of our real-time reproduction number is less than 1, namely 0.23, and Bermuda's current country status remains at sporadic cases. We have now added an interactive coronavirus dashboard to the gov.bm coronavirus website at www.gov.bm/coronavirus COVID-19 update. It is updated daily between 6:30 and 7 o'clock p.m. It provides statistics on active cases, cumulative cases, recovered, and other data around COVID-19. and the public can manipulate this data with the dates for the information stemming back from March to 2020 to date. Additionally, a new page on the coronavirus website contains guidance for holding events and gatherings. This page includes a link to the exemptions for large gatherings electronic application form that must be completed to request an exemption from the Minister of National Security to gather in a group of more than 25 persons. This new page has been linked to the top of the COVID-19 guidance webpage, again at www.gov.bm/coronavirus guidance. And this is under the heading Events and Gatherings Guidance. Bermuda, stay informed of all of the latest developments about COVID-19 by regularly visiting the Government of Bermuda's website at coronavirus.gov.bm. I would now like to provide an update of the coronavirus 19 vaccination program. We have completed the second full week of vaccinations for the period through the 23rd of January 2021. Bermuda has vaccinated a total of 2,932 persons, and the breakdown is as follows. A total of 1,227, or 42%, are males, and 1,705, or 58%, are females. With 845, or 29% of those persons are under 50, 881, or 30% of those persons are between the age of 50 and 64, 598, or 20%, are between the ages of 65 and 79, and 608, or 21% of those persons are over the age of 80 years of age. With respect to the vaccination sites, the vaccination center at the Police Recreational Club administered 2,021, or 69% of the vaccinations. 152, or 5%, were administered at rest homes. 730, or 25%, were administered by the Bermuda Hospitals Board, and 29, or 1%, were administered at corrections. Assessed against our vaccination targets, the ministry can report that as of the first groups in Phase 1, we have vaccinated 608 persons, or 20% of those age 80 or older, 294 persons, or 40% of those in rest homes and long-term care facilities, 602, or 25%, healthcare workers, and 799, or 34%, essential workers. We can see we still have a long way to go until critical groups that are at risk are safely vaccinated. If you know anyone in any of our high-risk target areas, please encourage or help them to register their interest online at forms.gov.bm/COVID vaccine. As I have said before, vaccines save lives, and it is no different with the Pfizer-BioNTech vaccine being used in Bermuda now. Getting the vaccine greatly reduces your chances of contracting COVID-19. In fact, the Pfizer vaccine has been shown to be 95% effective in this regard. If you do get COVID-19, you are likely to experience more mild symptoms and become less ill, as your body is better able to fight off the virus. This means we can keep people out of the hospital and have less deaths due to COVID. With a reduced viral load in your system, it is also hoped that you are less likely to transmit the coronavirus as well, although that aspect of the vaccine's power is not fully known at present. The ministry has taken steps to provide information about the vaccines and vaccine safety online at www.gov.bm/vaccines. Check out this webpage to learn how the vaccines work, find out about its safety, educate yourself about the benefits, possible side effects, and more. We encourage you to get your information from this trusted source. Not everything that you read on Facebook is true. As was reported yesterday, the Ministry of Health has been working to identify suitable locations to serve as additional vaccine centers before the arrival of the next batch of vaccines. This is necessary as it will allow the ministry to dramatically increase the number of vaccines we are able to administer on a daily basis and will provide residents with more convenient options to get vaccinated. One of the sites that was identified was the former emergency room that was previously located in the wing of the hospital closest to the Berry Hill Road, and I am pleased to say that Bermuda's second vaccination center opened up yesterday. The Bermuda Hospitals Board Vaccination Center will initially be open from Monday to Friday from 8 a.m. until 5 p.m. and will be able to administer approximately 150 to 200 vaccinations per day on an appointment-only basis. At this time, vaccinations will not be given to walk-ins, and the system that we currently have for appointments will remain in place. I would like to thank again everyone at BHB who worked tirelessly to get the second vaccination center open and ready for operations yesterday morning at 8 a.m. The current protocols do require that you register your interest to be vaccinated online first. For those residents who haven't registered as of yet, but would like to, as I mentioned just now, the registration form can be found at forms.gov.bm/COVID vaccine. While we continue to ask those in priority groups 1A and 1B to register their interest, I must emphasize registering your interest does not guarantee you an appointment at this time. When you submit your registration form, you will receive an auto-generated submission receipt. Your submission will be filed and you will be contacted as appointments are scheduled. Please remember that appointments are based on a medical risk assessment that is conducted manually by the medical team. Currently, the focus is on all those who are eligible in priority groups 1A and 1B, and then based on age and medical vulnerability. Every submission will be replied to, and there's no need for you to resubmit. For the week ending January 23rd, 2021, 10,691 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 1,534 are black, 5,430 are white, 889 are mixed or other, and 2,838 did not specify or preferred not to say their race. To reach herd immunity, we need many more people to get vaccinated. For those that have already indicated their interest and are getting appointments, the ministry has been informed by members of the prospect vaccination team that they are encountering an issue which is leading to residents experiencing delays when they arrive for their appointment time. Specifically, I am referring to the issue of traffic and the number of people who are coming to the vaccination center without an appointment. I'm appealing to the public for their assistance with this. If you do not have an appointment, please do not attend the center as there are no walk-ins available at this time. Additionally, we ask the public to please note that only one person is allowed to accompany a family member, and you do not need to arrive early. For both the center, you should arrive no earlier than your appointed time. Of course, if you are assigned an appointment, it is critical that you show up. The vaccine supply is not unlimited, and we cannot have wastage. The ministry has also received queries as to whether non-Bermudians are eligible to get the vaccine and how much getting the vaccine costs. I can confirm that the vaccine is available to all residents, but again will only be allocated based on the priority phase in which we are in. I can also confirm that there is no cost of the vaccine for any island resident. The vaccine is not available to non-residents as we seek to achieve herd immunity here in Bermuda, and only residents can make this happen. The next batch of the Pfizer-BioNTech vaccine doses are scheduled to arrive in Bermuda later this week, and the Premier will provide further details concerning this. As more doses of this vaccine arrive and become available, we will be moving to the National Allocation Strategy next phases. So at this time, we are asking for people in phase 2, which is people 50 years and older, as well as vulnerable persons, those with heart disease, chronic kidney or liver disease, diabetes, for example, essential travelers, and residents with disabilities to register their interest online. As we transition through these phases, there will be changes to the protocols, and these changes will be communicated to you, the members of the public. I can say that we are reviewing vaccine center resources, hours of operation, and shifts because from the 1st of February, we must be able to administer both first doses and second doses. This means our capacity must increase to more than 800 vaccinations each day to vaccinate approximately 19,500 or 30% of our population by the 31st of March. To conclude, preventing infection, the onset of the disease itself, and community spread via mass vaccination will be a critical part of how we navigate our way out of this crisis. We have all felt the impact of COVID-19 that it has had on us, each and every one of us personally, and we all know how it has impacted our island's economy. Getting vaccinated is an integral part of our ongoing collective effort to reduce the spread of the virus here in Bermuda. This is essential, not only for our health, but also to help allow us to return to a sense of normalcy in our daily lives. Thank you.
Minister, thank you and your team for your continued hard work over the last 10 months that we have been battling this virus. Your work enabled us to contain the recent outbreak, earn us an upgrade to our country classification, and has seen the opening of a second vaccination center at the hospital. As the minister has said, the second vaccination center allows us to expand our vaccination program to serve more residents. As a country, we should be proud of the continued progress that we are making in managing the pandemic. The officers, many of our family and friends on the front line daily working for us, deserve our gratitude. The measures that have been put in place to date have been largely effective, and I encourage all residents to continue to follow them. The Cabinet will be reviewing all regulations next week at the regular 2-week interval, and I will provide an update at next week's press conference. Despite the progress we are making, the coronavirus remains a severe threat to public health in Bermuda. At 6 a.m. yesterday, January 25th, the public health emergency order expired, and a new public health emergency order with accompanying regulations came into effect after being signed by the governor. The new Public Health Emergency Order 2021 replaces the 2020 order, and there are no substantive changes to the regulations which were outlined last week. The new order and regulations are set to expire at 6 a.m. on February 24th. If the Minister of Health is satisfied that at that time we are still in a public health emergency, she will ask for the order to be extended when the House of Assembly convenes on February 19th. It is essential that we keep doing what we have been doing for the last 2 months to ensure that this virus remains under control as we ramp up our vaccination program so that we can see the end of this public health emergency as soon as possible. The best way to assist in that aim of ending the public health emergency is to get the facts surrounding vaccination, and following that, get vaccinated when you are able to do so. If we want to return to our pre-COVID lifestyles, it is essential that as many persons as possible get vaccinated. Government House, earlier today, has confirmed that an additional 19,500 doses will arrive on the British Airways flight on Thursday, January 28th, weather permitting. This is enough to fully vaccinate at least 9,750 additional residents. As a country, our goal remains to vaccinate 19,000 residents, or 36% of the eligible population, by March 31st. And I remain confident that as a country, we will meet this target. There are many countries around the world that are still waiting to receive their first doses of vaccines, so we are very fortunate. However, we must not take this for granted. I encourage those persons who are eligible in Phase 1, those 65 and over, to get the facts and register to receive the vaccine. If you have questions or concerns, speak to your medical doctor. Do not make a critical medical decision based on advice from social media or a WhatsApp forward from your friends. You wouldn't rely on that for any other medical decision, so do not do it with this one. Go to credible and trusted resources for your information. Research, talk to the experts and professionals whose job it is to advise you regarding your health. The faith and trust we have shown in our testing system should also apply towards our vaccination program. You should not leave it up to random social media posts to advise you on how to best protect yourself and your family from the coronavirus, or worse, cause you to not take the vaccine, which can help you protect you and your loved ones. I do welcome the news that there has been an increase in the number of Black persons registering their interest in the vaccine has been seen by the last few days of registrations. As more people understand how the vaccine works and sees for themselves that it is indeed safe and effective, I'm confident that more Bermudians will step forward to get vaccinated. My hope is that with the trusted information available from the government, with the leadership and guidance from local physicians such as Dr. Willard Warner and Dr. Kaiwan Brown, and overseas Bermudian physicians like Dr. Shama Williams and Dr. Michelle Spencer, we can continue to move persons towards vaccine acceptance. I thank these doctors for leading by example and getting the vaccine and continuing to help promote its safety to their patients and to the wider public. We have all seen how we've come together as a community to tackle crises, emergencies, and natural disasters. You need to look no further than what happens in every neighborhood across the island after a hurricane to see the true Bermudian resilience and spirit. Let us harness that same spirit of togetherness to protect one another by getting the facts around the vaccine and when it is our turn to get vaccinated. I'm now going to address a recent incident regarding an imitation firearm. Carrying an imitation firearm in public puts you and others at risk of injury, or worse, it can also be unlawful. Thanks to the quick response and precise decision-making of the Bermuda Police Service, no one was hurt. I thank them for the handling of their situation, and I ask those in the community, please do not carry imitation firearms and put yourselves and others at unnecessary risks. Ensure you are getting the necessary permits if you are engaged in artistic activity to ensure that everyone remains safe. It's been rather cold and windy for the last few days, and as you may have heard, we're expecting more bad weather for the rest of the week. The Bermuda Weather Service is forecasting gale and storm force winds that can reach gusts up to 70 knots. And all are asked to pay attention to the updates from the government and the Bermuda Weather Service. The Minister of National Security, the Honorable Renee Ming, will convene the Emergency Measures Organization tomorrow in order to ensure that we are prepared for the winter storm. Following the meeting, Minister Ming will provide the country with an update on the weather and the activities that will be undertaken by EMO agencies. The Ministry of National Security is also working with the Ministry of Social Development and Seniors to provide accommodations for Bermuda's unsheltered population to keep them safe during the extreme weather. We know that many in our community may need extra support emotionally. If you need someone to talk with, please avail yourself of the Emotional Wellbeing Hotline. That phone number, which is still being manned, is 543-1111 and remains open every Monday to Saturday from 5 p.m. to 9 p.m. There is help available if you need someone to talk to, if you're feeling anxious, isolated, or are not feeling yourself. So please do not feel the need to suffer in silence. You may call 543-1111 and there is help available. As I close, to get accurate and reliable information, please sign up for the government's WhatsApp service. Add the phone number 504-6045 to your contacts and send a simple message saying hi, and you'll receive WhatsApp updates from the government of Bermuda, including any warnings due to this week's expected inclement weather. And as always, you can always get the latest updates from the government of Bermuda's Tree Frog app, or regarding the coronavirus, you can go to coronavirus.gov.bm. With that, I'm happy to take any questions that members of the media may have.
Good evening, Trevor Lindsay, TNN News. Happy belated birthday, Minister.
Thank you, Trevor.
Yes. My first question is to you. For those over 600 possible positive persons that have recovered from this COVID-19 coronavirus, would they be given vaccines by any chance? What's the status on them receiving vaccines?
Our hope is the status with respect to them receiving vaccines and any other Bermudian or resident that wishes to receive vaccines. We will have sufficient supply for everyone that wishes to have a vaccine. So, of course, our hope would be that they would too commit to vaccine acceptance and get vaccinated. So they're part of the general population, and we would certainly encourage them, like we encourage everyone else, to be part of the vaccine acceptance program and ensure that you get vaccinated, not only to protect yourself, but to protect your loved ones and the other members of the community.
Good stuff. Premier, I don't know if you've spoke of this, but taxi drivers, I got word from several taxi drivers that are suffering. One driver said he made $25 in 2 days, and they are exempt from the unemployment benefits. Are there any relief packages for our taxi drivers?
As I'm aware, there are none, but I can certainly understand that with reduced level of flights, that there would be challenges. I'm happy to undertake and I'd encourage any, I will ask the Minister of Transport actually, to reach out to the the taxi associations on those matters and ask them to bring any updates to the cabinet when we meet next week. The Minister of Transport is part of the COVID subcommittee, so we can discuss that next week, Monday. So understood, and thanks for the question.
Thanks. And on the note of you as a tourism minister, can we get an update on any progress or possible renovation at Southampton Princess?
No updates to report right now. There may be updates to report next week.
Okay, and another question, back with that same Southampton Princess issue. Premier, you stated in a news conference that GEMCO would be paying back the $11 million to the government, paid to the South P workers. If this is the case, why did the finance minister say last week that the same workers are preparing a class action lawsuit with GEMCO to recoup the $11 million?
Well, I think that it's important that all options are on the table. I think the Minister of Finance was speaking in regards to the government of Bermuda's legal position. It remains to be seen what will happen, and I'll ask you to ask the same question next week.
Thank you. My last question, I want to change a little bit from the COVID press conference. We seem to have a crisis on our roads, Premier. Many accidents, serious accidents. What is the government going to do? And from talking to a few police officers, their budget have been cut. So we've got less officers on the road. How can we reverse this trend that is happening on our roads?
I'm not sure more officers on the roads will cause people to slow down, and I'm not sure if the government being everywhere at every single time can assist in that. What I will say is the most important thing is that persons accept the personal responsibility for themselves and to slow down and take their time. That is a surefire way to prevent road traffic accidents in most instances. It's about care, caution, courtesy, and drive slower. And that's the best advice that I can offer.
Thank you, Premier. Welcome back.
Good evening, all, and thanks. Jonathan Bell from the Raw Gazette. Yes, Minister of Health, you mentioned that non-residents are not eligible to get the vaccine. Are you able to tell us, I mean, how do we find out, how do we check if people are residents and not residents when they show up to get vaccinated?
It's non-Bermudians are ineligible to get the vaccine. All residents are eligible to get the vaccination.
Yeah, but if non-resident people aren't eligible, how do you find out when
When you
people
present
show up?
yourself, you have to bring some type of ID.
Right. Just figured I'd check.
Mm-hmm.
Thank you. We got a call asking about the administration of the vaccine reservation system. She said her husband had first registered by phone on the first day that she could, which is January 11th, and registered online the next day, for which they received a confirmation. Since then, they say they've heard nothing, and the people they called at the COVID hotline said they could not help them. They said they were aware of people in the same age range, and that's in their 70s, with no underlying conditions who registered later and have received appointments. You've mentioned that it's vetted by a medical team. These folks just wanted to hear more about what system is in place to assign the appointments. I don't know if you're able to address that.
Okay, thank you for that question, Jonathan. I can answer that in two ways. One is, like you rightly said, it is vetted by a medical team, and so they would then be in a position to know what the underlying medical conditions are, because we are prioritizing based on vulnerability. And admittingly, it is oftentimes difficult to just look at someone to see whether or not they have a medical condition. So somebody that may, in your own knowledge, think, well, they got an appointment, I don't. We don't necessarily know what their medical conditions are. Also, as I've indicated, with respect to phase 1 and phase 2, those are our priority groups. Everyone will be contacted. They would have, as you indicated from the persons that sent you that message, did receive the email confirmation, auto-generated email confirmation, but we're just going through them all. We don't have electronic medical records here in Bermuda, so we don't have a system like some jurisdictions where they can actually plug a key and say everybody that has diabetes or everybody that has COPD or everybody that has these particular chronic illnesses, give me the list. We don't have that in Bermuda. So unfortunately, we are at a disadvantage in that regard, which is why we have a medical team that's actually going through the listing. As you register, you indicate if you have any type of medical conditions, and the medical team are going through it and effectively triaging the persons that have registered based on age as well as medical condition.
Thank you. And this may well just tie into that. That same caller said they were aware of elderly folks who they said had to wait 2 to 3 hours to get their vaccinations last Thursday and Friday. Just asking if you would be able to, if you might know what caused the delay there.
I do know what caused the delay. Actually, I mentioned it in the statement. We have two things that
Too
have
many
caused the
people
delay.
showing up.
One is people showing up without an appointment, and we are asking members of the public to please bear with us and do not attend if you don't have an appointment, because that will create a bottleneck. Two, there are a finite number of parking bays that are in the front of the police club, and the regiment will allow the persons that have scheduled appointments to go up, park their cars, and walk in. However, persons are blocking in people. There's a lot of cars that are going up there where they're dropping people off instead of just dropping the person off, driving around the block and then coming back for the person. So a lot of the delays, unfortunately, are as a result of members of the public not parking properly or waiting outside for the person instead of moving their car so other people that have an appointment that is scheduled can go in, assess the vaccination clinic, and then leave. And then secondly, again, at this point in time, we do not have the facilities for walk-ins. It is certainly something that we're working to, as we continue our rollout of vaccinations, it is certainly something that we will be considering. And I can assure you, Jonathan, that when we do open it up for walk-ins, the press, members of the press will be the first to know. But at this point, it is not open for walk-ins. So please, members of the public, if you don't have an appointment, please don't show up, because you are creating a bottleneck for other people.
I see. So that's on us. That's a serious issue. I mean, we've got some rough weather coming tomorrow. There are a lot of folks wondering if we have any kind of contingency plan in place if British Airways can't land. I don't know, Mr. Premier, if you're able to address that, or if that's something from Ms. Ming in the morning, but we wanted to check.
We certainly have contingency plans in place, and the fact is that we're not scheduled to run out of vaccines between now and Thursday, as we have 9,750 on island. So should be fine, even as we ramp up, but it is weather permitting. I am certain if British Airways, for some reason, is not able to come in on Thursday, they're not going to wait until next Thursday to fly. So, but of course, that presents its own logistical challenges with the transportation, et cetera. So all those things are being monitored on that side. Nonetheless, Government House has confirmed this shipment, and we are looking forward to receiving it.
Thank you, sir. And you mentioned Financial Secretary Mr. Anthony Manders. Tons and tons of folks knew Mr. Manders very well. Are you able to tell us if there has been an exemption permit granted for Mr. Manders' funeral?
No, Mr. Manders' funeral is taking place at the Heritage Worship Center. The regulations are that 20% occupancy in facilities like that, it's one of the largest, and there is no exemptions. As we said, exemptions are not being issued until February 1st.
Okay, gotcha. My last one for you, probably yourself, Ms. Wilson. We wanted to know, we're hearing of other variations, different types of this virus. We've been able to do some gene sequencing. Do you know if any samples of the virus are now being gene sequenced for these UK, Brazil, South African variants?
I don't know specifically. I know that we did send some samples over to the UK Public Health England for them to do some gene sequencing. As we've indicated here in Bermuda, we are anticipating that through the MDL lab and Dr. Karika Weldon under her stewardship that we will be able to facilitate gene sequencing in Bermuda in the not too distant future.
Thank you, Connie. Evening.
Bermuda Broadcasting.
Good evening, Don Burgess, Bermuda Broadcasting. Premier, you announced a goal to vaccinate, or the health minister, both of you, announced a goal to vaccinate 36% of the eligible persons by the end of March. When and how do you intend to vaccinate the remaining 64% of the eligible population, i.e. all citizens over the age of 16?
We will continue, as I indicated earlier today and yesterday. You would have seen, I missed you there yesterday actually, the opening of the Bermuda, the second vaccination clinic at the hospital. We will continue to roll out further and ramp up our vaccination output. We are looking at extending hours, getting more resources, working on the weekends, as well as other potential sites. So right now we have 2 sites, and we are absolutely certain that the aggressive provisions that we have listed with respect to increasing and ramping up our vaccinations so that we can meet that target of 19.5 by the end of March will be met. We are ramping it up and working diligently. I'm fortunate enough to work with a very, very hardworking team at the ministry, and they recognize that this is a government commitment and a community commitment to ensure that we get herd immunity, and they're doing everything and pulling out all the stops.
I would have loved to have been there yesterday, but I had a teaching assignment at Clearwater.
Of course. Okay.
So our youth are very important.
Yes, of course.
The Cayman Islands appear to be vaccinating citizens much more rapidly than in Bermuda, and they're using the same amount of vaccines as Bermuda received from the UK. Vaccines compared with 2,932 in Bermuda. Why are they able to vaccinate more rapidly than Bermuda?
As I said, our first and foremost objective is that we will ensure that we are confident that we will be able to vaccinate 19,500 persons by the 31st of March. That is our very, very aggressive goal, but we are certain that we'll be able to meet it because we are rolling out more vaccine facilities. I think it's also important to note, as I mentioned a few moments ago when Jonathan asked, other jurisdictions, Cayman being one of them, does have electronic medical records, so they can, with the touch of a key, ascertain all the persons that have certain chronic conditions. We are doing it manually. They also have electronic immunization records, which Bermuda doesn't have. Part of our electronic immunization records, which is starting now, is with the vaccinations.
So going forward, we're going to do everything electronically, like the Cayman has.
I wouldn't know if it's that far, but let me just answer a different question. I remember it was probably you in a press conference in April saying that Cayman was testing more than we are, and now look where we are. The fact is that this is not a race and or a competition. We've set our targets. Other people can do that and inquire as to what pace may happen in other places. We know the targets which we have, and we're going to meet the targets of 38,000 doses in arms by March 31st.
Okay. What percentage of the population do you expect you're going to need vaccines for?
I'm sorry?
What
pardon me?
percentage of the population are you going to expect we're going to need vaccines for? Because some people are vaccine hesitant and some people are against having a vaccine.
Right. We do know that there are some people that are. We want to highlight and encourage vaccine acceptance, recognizing that when you become immunized, you are not only helping yourself with respect to the fact that you are minimizing this. This has 95% effectiveness, and you're also helping to gather herd immunity. You're part of that herd, so to speak, so that you can help to mitigate against the continuation of the disaster that COVID is doing in our community, well, all throughout the world, but let's speak generally to Bermuda. We are looking to get herd immunity, which would be approximately 60 to 70% of the population. It is a very it is a goal, and we think it's achievable. We have to just continue to educate members of the public, recognize that, get the facts. The information is all out there for everyone to see on the website, so that you can see what is the real evidence behind vaccinations. We need to ensure that not only are we getting the message out, we're also going to be starting a champions drive, so that there'll be other politicos and other public figures, whether it be sport, the media, volunteers, anyone. We're just going to try to get the message out, and we're seeing a shift with respect to more persons wanting to be accepted. When we did the omnibus survey, admittingly, there were persons that had reservations, but they wanted to play a wait and see. And now that we're seeing that more persons we're almost at 3,000 persons that have been vaccinated, we're hearing more and more people, and we're getting more registrations, and people are like, okay, well, let me go ahead and get vaccinated, not just for myself, but for my family, my loved ones, and the members of the community.
Okay, thank you. Revisiting our question from last week about Pfizer, the company has said that each vial of the vaccine contains 6 doses, not 5, and even 7 in some cases, but it requires a special syringe. The FDA gave approval to labeling each vial as 6 doses on January 6th. Is Bermuda getting the proper syringes that will end up giving us 20% more vaccine?
Yes, as I reported when you asked that question last week, we do have the proper syringes. Some of the doses are 6, and when we can get 6, but we have to admit, as with any vaccination, there will be wastage. So there is a possibility that if we can get 6 doses out of the vial, we will. The directions for the Pfizers that we received, because as you said, you're referring to the FDA saying something on the 6th of January, which was last week. The directions for the vaccines that we received says 5 doses, but we are able to get 6 in many instances. And when we can, we will, but I have to remind you that there will be unfortunate times where there may be some wastage with respect to the vaccinations.
Thank you. Does government feel vindicated about its approach to traveling now that many other countries are requiring negative pre-arrival tests and tests on arrival?
I'm not entirely certain that vindication is the right answer, but we have proved during this time of the pandemic that we must have the trust in ourselves to come up with solutions and work with our persons that are here and Bermudians around the world to come up with solutions that work for Bermuda. And so in that case and instance, it's not a question of being vindicated. It's a question of trusting ourselves to make the decisions that are in the best interests of Bermuda. And so when there was advice to say, oh, that's not necessary, when there was advice to saying, oh, follow what Public Health England is doing in the earliest stage of the pandemic, when there were so many different things about, oh, you don't have to, that's not necessary, we trusted our own instincts. We did what we thought was necessary to preserve our biosphere. And for the most part, we have been successful. So as I said, there's always tweaks. It's not a question of vindication. It's a reaffirmation of the confidence that we have to have in ourselves to come up with the right and correct policies ourselves and put them in place to benefit our country. So that's what I think is the most important thing. Bermudians oftentimes like to look to other places, like to see what other people are doing, like to compare and contrast and all the rest. So we have to be confident that we have the ability to examine what we have in front of us and to make the correct and proper decisions for our country. And I think that we've seen that by and large it has been successful.
Okay, thank you. My last question for the night. Forbes had planned a conference here, 30 Under 30, which was supposed to bring 600 people here to the island, and one of the reasons listed in the Guardian news article was the CDC had Bermuda listed at level 4 travel advisory. What part do you feel the cases back in November had in impacting and us losing that conference?
Well, I can't actually speak to what may or may not have had us losing the opportunity. As the Minister responsible for tourism, I'm without question disappointed. The fact is that the Bermuda Tourism Authority and other agencies continue to work to promote Bermuda as a safe place for off-sites, and we have off-site events. Trevor was just asking about taxi drivers and other things. The fact is that as long as we manage the risks, then we are fine, and that's what this is about. This is about managing the risks. So we will continue to work I'm certain that the teams are disappointed. I'm not entirely certain what impact that may or may not have had. I think that you can see from today, we have 30 active cases. Our R number, our one-day R number is down to 0.14. Our 30-day reproductive number is 0.3. We are certainly in the right direction. We continue to maintain our enhanced testing program. We are rolling out additional surveillance via saliva to many different places throughout the country to make sure that if there's any other outbreaks, we can catch them early. So, I mean, we just have to continue working. And so for us, it's about having the confidence ourselves to make sure that we can manage the risk ourselves. And I think that we're going to continue to see improvement. It's important that everyone does their part. And as long as everyone does their part, I think as a country, we'll be okay.
Thank you very much.
Media Meyer?
Good evening, everyone. Maya Palacio here for Media Maya. I'll take this off. I'll just continue off of what Don actually was talking about, which was the Forbes 30 under 30, because I do have some questions about that myself. So the idea of the 75 people traveling to Bermuda and staying in a bubble has been canceled. However, from the sources, it says that it was stated that the directions or the director of this had communicated with the Department of Health about, the travel and the opportunities. Can the Department of Health confirm that there was communication on this project?
I don't know specifically. As I understand it, the BTA were taking the lead and liaison with Forbes 30 over 30, and that would have necessitated them involving the Department of Health, certainly to ensure that the health guidelines were adhered to.
Okay. So can either yourself or Mr. Premier, can you explain as to why it was canceled overall?
I have no idea why it was canceled. I'm disappointed it was canceled. It was up to me. The event would be going forward, but it's not. And so that's just the nature of what it is that we have. So I can't explain why. The Minister of Health is stuck in the day-to-day decisions of the Health Department, and the Premier and Minister responsible for tourism are not stuck in the day-to-day matters. I had heard broadly about the idea that this was possibly in November, and I didn't hear anything more about it until I want to say Monday morning, when there was an email that had alerted us to things that were taking place surrounding it. But as I said, and I think is the statement that went out from the Tourism Authority, that we're disappointed. But hey, it is what it is, and we will go on to continue to do the work to ensure that our hotel workers can remain employed during this time. And so while we have other companies that look to bring their offsite events here, to stay in bubbles, to bring that business to our hotels, whether it be Hamilton Princess or Tucker's Point or Lorne or Guadalupe or the other hotels that remain open, we are going to continue to do what we can to support our fellow Bermudians in this country who depend on tourism jobs to provide for their families. And the government of Bermuda will make no apology for that.
Okay, thank you very much. And my last question about that Forbes 30 under 30 is they did have quite a lengthy list out explaining, how the project was going to run in a Google Docs that was posted and leaked from a reporter, I believe, of Forbes. And one of the points in there was like the matter of cost. I don't know who could speak to this, but they had mentioned that the usual price for a room for a month at the Hamilton Princess generally runs about $20,000, and I'm quoting here. For this event, one person in a room with one bed will cost $4,500 for like a month. I don't know if anyone could speak to how that dropped so drastically from $20,000 a person to only being $4,500. Does that sound economically feasible for?
The one thing I would say is that you'd probably have to contact the hotel. But I think on just a regular basis, when you're talking about regular rack room rates versus discount rates in a group setting, that all hotels will price competitively their rates. Anytime you've gone to wedding or some type of events, you get a discount for a large group booking, and I was just going to assume that that was about it. As I said, we were not privy to the specific details. I'm certain that the Bermuda Tourism Authority would have had a lot more information and working on the specific details. But as I have said, we continue to work to attract groups to Bermuda, groups such as these who can maintain our public health protocols. And that is something that is important. And we do it because we want to ensure that we are supporting the Bermudians that rely on our travel and tourism industry to provide for their families.
Thank you very much. Minister of Health, what happens when someone has taken the vaccine on the day here in Bermuda? Let's say they go to the institution wherever they have to go. Once they've taken it, are they monitored for 15 to 20 minutes, depending? And is there an EpiPen available if necessary, should they require it?
Those are very good questions. Thank you, Maya, for asking that. Absolutely. Part of the protocols with respect to setting up the requisite vaccinating centers is to ensure that we have proper health protocols, health and safety protocols. So yes, there's a crash cart, there's EpiPens that are there just in case a person has a reaction. We have St. John's ambulance on site at the police club's facility. We also have a required 15-minute monitoring after persons have been vaccinated. And if there's any display of any type of challenges, or alternatively, if they have a precondition to perhaps something that's in the vaccine, then they might have to do a 30-minute observation. Like I'm personally allergic to penicillin, and when they went through the questionnaire, they were trying to consider whether or not I should do 30-minute observation as opposed to 15. But because the reaction I've had is only once, and it was 35 years ago and very mild, but that's part of the medical assessment.
Thank you very much. I'm sure a lot of people will be happy to hear that information. My next question actually comes from a community member who works in the medical field. They're asking, why did government allow a visiting doctor to take out his wristband and not quarantine before he saw patients? It said he arrived in Bermuda on Saturday and came into the hospital on Monday. Would there be any reason as to why they get, that special treatment to do that?
I don't know what case you're speaking about, so I can't speak specifically, but I can say that under the the quarantine traveling, oh dear.
Guidelines?
This is a different word. Continuum, thank you. There are certain carve-outs depending on the nature of your profession. So for example, and I don't have it, and I would certainly invite you to look at the website, so forgive me, or I can get more details for you. But depending on certain occupations, if those occupations are such that they are in short supply and required because of the nature of their occupation, then I know that it's not that you don't have to quarantine, because you do, but there are certain exemptions, so to speak. I don't know the particulars, I'm afraid, but there are definitely on the continuum, there are carve-outs as it relates to specific occupations. However, I don't know what case you're talking about in that particular scenario, but if you look at the continuum, day 4 is when you're at intermediate plus, so that you can have further activities such as going to bars, nightclubs, etc. Not bar, well, there are nightclubs, but the continuum speaks to it, Maya. And I'm sorry, I can get the information for you, but I do also know that there are certain occupations that their guidelines are a little less prohibited, simply because they may be the only particular speciality, exactly, and that they are needed for that particular purpose. But certainly they do have to adhere to the continuum, the 14-day continuum. But I don't want to speak to the case you're talking about, because I don't know.
Understood.
Okay.
Would that, on the website, where would you be able to find exemptions for those type of persons?
I will. If you go to the COVID, I'll get it for you. But it certainly would be the COVID-19. COVID Bermuda. www, I should know it by heart. COVIDbermuda.bm. But I can get you that information.
Okay. Thank you very much.
www.gov.bm/coronavirus. I just found it.
Got it. Awesome. And my last question, pretty basic, but the boat curfew. Can anyone speak to what that is right now? Because people are blowing up my phone about that.
I don't think it's changed. It's still 6 p.m.
Okay.
Darkness.
Cool. No changes.
Subject to review as of next week.
Yes. February 2nd.
No problem.
Thank you.
Thank you very much. I thank members of the media for their questions this evening. God willing, we'll be here next week, Tuesday, again, with an update to all persons in Bermuda. As I close, I had said before that the United Kingdom has committed to providing additional vaccines, and there was a release from Government House in which they had confirmed this and further vaccines to be supplied. And certainly, I appreciate the support of Government House in the assistance in the procurement of these vaccines. So with that, I wish everyone a very safe and happy evening. Please make sure to remain tuned to the Governor Bermuda updates to ensure that as the inclement weather approaches this week, that you can remain up to date. Thank you, Bermuda, and good night.